Hello.
Can you share the screen later after I've done the intro,
Okay.
please? Thank you. Sound Jai Shri Krishna, Jai Jirendra, Jai Swami Narayan, Sai Ram, and good morning, good evening to you all, everyone, in fact, and a very warm welcome to tonight's health webinar. Thank you all for joining us promptly this evening. We had a slight change of plan as Amy Hall is unfortunately unable to take today's session. However, we are absolutely delighted and grateful that Mr. Uttam Chouhan, pharmacist at North Wales Hospital, has kindly stepped in to lead this evening's event. So tonight's topic is medication. Your questions answered. This is a very useful and practical session, giving us the opportunity to ask questions about medications, treatments, possible side effects, and common health concerns such as iron deficiency, cardiovascular health, diabetes, blood pressure, and any other symptoms you may wish to understand better. We encourage everyone to make the most of this opportunity. Take advantage while it is. Please feel free to bring your questions forward during the Q&As or place them in the chat if you prefer. And before we begin, may I kindly request everyone to keep themselves on mute unless invited to speak, and also have your videos on, please, so we can interact face to face. So that we can keep the session also clear and smooth for all participants. And on behalf of everyone, I would like to sincerely thank Uttam Ji for giving his time and sharing his professional knowledge with this evening. Uttam Ji, welcome back.
Well, thank you very much.
Very hot. Yeah, I'm glad you're sitting outside in
Yes,
cool
yeah.
air.
Share my camera there, yeah.
Yeah.
It's just too warm today.
It is.
I'm sure it's the case everywhere else as well.
Yeah.
So has anybody got any questions that specifically have got burning things that they want to ask, or shall I start on something?
Start on something.
Well,
unless anybody has.
I can't see the chart, so.
No, because you are sharing the screen.
Okay.
Are you going to share something?
I'm not going to show anything.
No,
I'm just going to talk.
Question.
Can you hang on? Hold on. Uttamji, stop sharing the screen and I'll handle from here.
Okay, I'll stop sharing the screen then.
Yeah.
Okay.
It works better that way.
Fine.
It works better that way. Thank you.
Can I ask a question?
Yes.
Polyps in one nostril. Because polyps in one nostril, should you have it operated at the age of 79 or to take steroids? Polyps at the age of 79 in one nostril, should you have procedure operate or not?
Sorry, I don't understand the question. I can't hear. Can you speak up loudly, please?
Polyps in right nostril at the age of 79.
Yeah.
Should I go for the operation or just treat by steroid? What's your opinion on it?
So you're on steroid tablets?
No, I'm taking a nose spray.
Can you spell it out on the chart?
It's RYAN TRIS.
RYAN.
RYAN TRIS.
Ranitidine.
Yeah.
Okay, so you're taking ranitidine tablets.
Nasal tablet spray, RYALTRIS. Nose spray. Nose spray.
I think he means Ramipril.
I don't think so. He's
No,
talking about a spray, a nasal spray, is it?
RYAL
YAL
TRIS.
TR right Rylpris.
That's right.
Rylpris. Okay, just hold on. I've never heard of it, but the trade names they change quite a lot most of the time. You say so. Okay. So that is a combination of steroid inhaler and so that's have you ever got some problems with your nose?
Our nostril, polyps in one nostril.
Yeah, some
green mucus coming out. Green
Okay.
mucus coming out all the time.
Okay, so have you been seen by a ENT consultant or by your
Yes,
GP?
I was seen by GP and consultant.
Okay, so that's
ENT.
ENT consultant. So they've given you this particular spray. Yeah. So this particular spray is for allergic rhinitis. So if you got severe allergic reaction, say for example to the pollen or grass pollen or something like that, constant, and then the steroid that is present in there is to dampen the inflammation there. You see, it's all the redness and the swelling that happens there. So it tries to dampen it. The main important thing with this particular spray, it doesn't work immediately. It takes time to work. So you have to use it regularly for it to work, you see. And you have to use it twice a day, morning and evening, regularly.
Yeah, I'm using the thing.
Yeah. So how long have you been using it for?
Maybe 1 year now. 1 year.
For 1 year.
Yeah,
And have you seen any benefit or no benefit?
no benefit.
No benefit whatsoever.
I still got this green mucus coming out of right nostril all the time. Green
Well,
mucus.
if you have not seen any benefit, then it's so important that you go back to your GP and discuss it with them, because you have and you need. Was it for the same kind of symptoms that you were having before? That before you started the spray?
Same type thing.
Yeah, if you're having the same kind of symptoms and you've been using it for such a long time and you have not seen any benefit, you have to go back and discuss it with your GP, because it's not working for you.
What about the operation? Can I go for the operation?
Well, the operation that will be that is not in my remit, and I'm not a ENT consultant or anything like that. So, but it's something that you may have to discuss with the ENT people. If they have given you this medication and things have not worked, then there's something else going on that they need to look into.
How can I stop the green mucus coming out? How can I stop green mucus coming out?
From your nose,
one nostril, right nostril.
or is it persistently green all the time?
Yeah, all the time green, quite thick as well.
And if it's persistently green, is there some kind of leakages going or something else is happening? So that's why you need to be seen by the GP again, saying this. You have to persist and talk to them again. This is not right. If you feel that is not right, you've been on this medication for 1 year and you've been using it and you've not seen any benefit, you have to go back and discuss it with them. That's all my advice would be to you.
Thank you very much. Thanks a lot.
Okay, I can't answer everything, but I think if you're using it for such a long time and have not seen any benefit, you have to go back. You have to go back and ask your GP, or if your GP can't do, you have to refer it back to the ENT people.
Okay, thank you. Thanks a lot.
Okay.
Thanks for your time.
Thank you.
Thank you.
Anyone else would like to question?
Okay, so if there's no question, I will just say a few words about the high temperatures that you are getting currently, and how and what are people doing? Because if people are taking some medicines and this high temperature for a prolonged period of time, how are they coping with it, and are they finding any difficulties dealing with it? If you want to if you want to ask any questions on that, please feel free to do so. No questions? Well, it's very quiet today.
Okay, Uttamji, for people who take regular medications, what are the most important things they should understand about their medicines?
Well, if they are on long-term chronic conditions, they need to know why they are taking it first. It's very important to understand what symptoms or what's the condition they are trying to the medicine is for. That's the most important thing, and they need to know how to take that medication correctly, and for how long are they going to be taking it for. Is it going to be for a few weeks, or is it going to be for a few months, or is it going to be for a lifelong? They need to ask those kind of questions, you see. For example, if you have got blood pressure problems and a chronic blood pressure, then you'll be taking it for lifelong, you see. So, and if you're taking medication for that length of time, you need to know what it is for, and if you're taking it, and whilst you're taking it correctly, is it working for you? For example, if you're taking the blood pressure tablets, and if the blood pressure is still high, they're not doing the trick, you see. So you need to have evidence that the blood pressure is not coming down, and you're taking the medication correctly on a daily basis. So you need to arm yourself with that information. For example, if you're on blood pressure medicines, you should have a blood pressure monitor at home, and you should be taking your blood pressure recordings and record it with the date and the time and the reading. And if they are showing high values, then you take those particular readings to your GP and with the tablets, and saying these are my readings and my blood pressure is not coming down. And you have to arm yourself with that information and go there and discuss it, because with blood pressure, majority of the people will not get the desired drop in the blood pressure with one medicine. They will have to take more than one medicine to control the blood pressure. So it's very important for them to know what the condition it is, and why they're taking it, and what are they looking out for, you see. So, for example, if I give you another example, say if you are suffering from arthritis, and you're taking tablets for your arthritis that your consultant has given to you, may most likely the consultants in the hospital for rheumatoid arthritis, there will be some modern kind of medication, maybe an injection or some tablets that you take once a week. And if after about 7-8 months you're taking it, you're not finding any difference, you need to approach them again and say, okay, I've been taking this medication and they're not doing the trick, or they're causing some problems. So those are the kind of things I would ask all the time.
Yeah, yeah. I suppose the longer you take the medication, your body is not accepting
Well,
it after a little while.
That could be true as well, or the drug is not sufficient for it, or the body is or producing some kind of opposite effect, or is not doing the drug is not doing the job that it is supposed to be doing, you see. Or it could be causing side effects for you, you see, as well. So if it's causing side effects, then you have to go back, because you know your body better than anybody else. True. And if things are upsetting you, then you have to go back, and don't be afraid to be a nuisance, because it is your body after all.
But after a certain time, even the doctors get fed up saying,
Well,
this
I know they
lady is
get fed up. I appreciate that, but you are the one who is suffering with that particular problem, and and uh, and whatever they've prescribed, or the consultants, or the hospital, or the GP is not working, then you have to go back and persist on it. And I'm sorry to say, some diseases do require that. Many chronic diseases require that. For example, hypertension, blood pressure is a big problem. The other big problem with diabetes as well, that the medication changes quite a lot in diabetes. It doesn't stay the same all the time, because either the person taking it doesn't like it, or doesn't work for it, or the blood sugar doesn't come down, or it comes down too much. Things have to change, and the person taking those medication, whether it be tablets, inhalers, or whatever, they know the body well, and you should go back and ask. I know it is a nuisance. It is difficult to see them, but you have to go back and discuss things with them.
True, very true. Pravinaji, you've got a question?
Yes, actually, it's regarding my husband. I'm not at home. I'm at my daughter's, but he has been experiencing his blood pressure going down, and it was a bit higher a couple of weeks back. So the doctor told him to take extra. Now with the heat, I think he's finding it. He keeps watching. He keeps measuring, checking it up, and it's going down. But what has happened is, I think it's really leveled out nicely, and he's happy. So I wonder whether he should stop the extra medication that was prescribed. But obviously, he should see his GP now. Is that what your advice?
I think that's a very good question, actually. So if the blood pressure has been going down, so the GP started with one medication, and the blood pressure was probably still high, and your husband has been monitoring the blood pressure,
Yes.
and has been keeping a record of it.
Yes.
So the blood pressure is coming down, and that is the whole point of taking the blood pressure tablets, to bring it down, you see, and to keep it down.
Yes.
Yeah, and not to. So when it is down, and both these tablets is taking, it is suiting him, and his blood pressure is staying down, not too low.
It did go down quite a bit, I thought,
So when you say quite a bit, what does it mean?
It was like 110 over 70.
Okay.
And
so,
he's 81 years old.
Okay, that's fair enough. Now, as long as if he's of that particular age, and then I think we don't want the blood pressure to go down too low.
That's right.
Right. We don't, because like anything in life, there is a good balance, you see.
Yes.
Too much of everything is not good, actually, at all.
Yeah.
And if the blood pressure is too low, then he will probably get symptoms when he stands up. He feels dizzy, you see. He feels as though he's going to faint. He needs to hold on to something.
No, he hasn't felt like that.
Oh, that's good.
But he's a very strong guy.
Yeah, no, that's fine.
Yeah.
If he's tolerating these tablets,
yeah,
and as long as the blood pressure is staying about 120, 130, that's fine.
Yes.
That's absolutely fine, and that's what it should be, actually.
Yes, because mine is, yes.
Yeah, and blood pressure is so important to be well controlled, actually.
Definitely.
And in this particular weather, this heat wave that we're getting, and the body, because we are sweating quite a lot, we're trying to keep cool. And if you're taking the blood pressure tablets, the blood pressure falls quite a lot, you see, in this heat, you see, along with the tablets. So you just have to be careful, and he needs to drink plenty of water.
Yes, I do.
And just to make sure that his mouth is not dry.
Not dry at all, yes.
Yeah, so that's the important bit.
Yes, thank you.
I think so that's very important. Can I ask the question as to why did they start the blood pressure tablets? Has he had any problems?
No, he did, actually. This is going back to Oh Lord, 1996.
A long time ago.
Yes.
Okay. Yeah.
He went in. Actually, I worked there, and I was asked if I could ask my husband to join in the vitamin E. They were just going to introduce vitamin E for the heart people, and it was a trial. So I
Oh,
said,
that's right.
yeah.
Okay. Yeah.
So
Okay.
he did go for for
Oh,
the
okay.
first checkup, and that was it. He had high blood pressure. He was working very, very hard, and that was when he was in 96. I was 46, so he was 51. So
Okay.
at that age, he had to go on blood pressure tablets.
Yeah.
And it's not me making him mad or anything, but I think his persona, the way he gets a little anxious or worried about anything
Yeah.
that is not going right, being a businessman.
Yes. Yes.
So I try and keep things as cool as I can,
Well, I
because
think
I know.
I think you've raised such an important point actually,
Yes.
because blood pressure on the whole doesn't cause any symptoms. You see,
Yeah.
when it is too late, it causes problems when the event after, say, for example, after a stroke. You see, that's when you
Yes.
realize that
Yes.
have had
Yeah.
a problem. You see, which is too
That's it.
late.
Yes.
So the whole aim of these blood pressure tablets is to prevent people getting a stroke. It's a
Yes.
preventative medication.
It is. Yes.
So it's to prevent problems with the having a stroke,
Yeah.
having kidney problems,
Yes.
having eye problems. So
Yeah.
those kind of big problems which are very common in our Asian population.
Yes. Yes.
So it's so important to get the blood pressure very well controlled.
Yeah. Oh, good.
Yeah.
Thank you. Thank
And
you so much.
can I also ask, is he tolerating other than dropping his blood pressure to the right level? Is not causing any problems for him?
No, not at
No,
all.
fine.
No. No.
Can I then ask what drugs is he taking, please?
Oh gosh. He's taking enalapril.
Enalapril, okay.
Yes. And something else.
Something else,
Oh,
amlodipine.
yes, that's it. Yes.
Amlodipine, enalapril.
Yes.
So those are two important, very important group
Yes.
of drugs that are used for blood pressure blood
Yes.
pressure control.
Yes.
And as long as they work for him.
Yeah.
And one thing I would suggest, that he probably every year he does
Yes.
have has a full blood, has got a
Oh,
blood
he
test.
does. He does.
Blood test.
Actually, occasionally it is every 6 months.
Okay.
So I make sure that everything goes like clockwork.
Okay.
I like everything checked out, because I was diabetic and now I'm not so bad. I have reduced my tablets, and actually I can do without them. And
Good.
I was
Good.
only diagnosed a long time ago in 2005. And then COVID came, and I had actually gone off the tablets because I had reduced my carbs, and
Okay.
it happened. But then I was not checked in, and I used to check my blood every now and then. And then I was told, look, don't do it too much. Just get on with it. And I did, and I went for the workshops for diabetics
Okay. Fine.
several
Very
years
good.
ago, and that really sorted me out. I've
Very
learned
good.
exactly how to manage things.
Fine. Can I then also ask,
Yes.
if have you got your urine tested as well?
I know there is that little problem now. Yes.
You need to make sure,
Yes.
because you're diabetic.
Yes, I get it
Because-
done every 6 months.
Yeah,
Yes.
that is so important. That's
It is.
making sure there's no leakages of protein
Yes.
going into the urine. So that's so important.
Yes. And
Okay.
also, I don't have blood pressure.
Very good.
I never had it.
Well,
And
there
I'm
you
so thrilled.
Good. Excellent. Good news.
Thank you so much. Thank
You're
you.
Thank you,
welcome.
Karina. Doris?
Oh,
Doris, you have a question?
Yes, I do. Hello, Uttam.
Hello. Hello.
I had a terrible experience in A&E. I had to go off to A&E because I've had it really, 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 really bad pain in my knee, and spent the whole night there, and that didn't help at all. But the doctor that I saw, I had an X-ray and the usual, the ECG, the blood pressure and everything. And they decided that my problem in my knee was osteoarthritis. the x-ray showed that the bones were sort of grinding together. There wasn't is it the cartridge you call it? That keeps the joints subtle. And after several hours there, they prescribed some tablets for me. And I'm sorry I didn't think to bring them out to say what they're called. But, and she said, the nurse told me to take them for 14 days. So I said, well, what happens after that? She said, no, just take them for 14 days. So I managed to get home eventually. And I always read the instructions on tablets before I take them. And the first thing that shocked me was that they had access to my medical records. They know I am allergic to cocodamol. And the first thing I saw is that these tablets contained cocodamol. And then also they're an opioid, and you can become addicted to them, and you can be very sleepy. And I'm thinking, no, I'm not taking this. The cocodamol, first of all, it's there on my records, and then all these other things about me becoming addictive. I don't want to become a drug addict, so I didn't take them. I was talking to my son the following morning, and he suggested a health supplement. I don't know if you know it. It's called
Glucosamine.
Yes.
Glucosamine.
Yeah, Chondroitin.
Yeah.
And so I bought those, and I've been taking them. And when I get the pain, I take paracetamol. But I'm thinking, if I wasn't inquisitive about what they had given me, and I just gone ahead and taken these tablets, I would have been worse off than when I went in there for help.
Did you?
Yes,
Yes,
I think you raise several important points, and if you're truly allergic to medication, and if you take that particular medication again, then the likelihood of you getting that whatever reaction that caused to you in the first place will come again very quickly, actually. So if you are truly allergic, then it would come back very quickly to you. So if you are allergic to things, and if it is clearly stated in your records that you're allergic, they should not have given it to you. They should have questioned you quite thoroughly about your allergy. And so when you say, when people say allergy, can I? So for us, for the professional staff, when you say allergy, what it tends to mean is that when you take a medication, something happens fairly quickly within a few hours or within a day of taking it. You see, so either your breathing becomes very tight, or you're becoming quite short of breath, or something happens to your skin, and your skin becomes quite blotchy, and all those things kind of happen very quickly. Those are kind of allergic reaction, you see. Now, if people say that I took this particular tablet and I had some diarrhea and I had tummy upset, those are not allergic reactions. Those are side effects, you see. So there is a big difference between allergy and side effects, you see. So if you are truly allergic, and then say, for example, at the present time, the big allergy questions is with penicillins. So if you are allergic to penicillin, and if you take penicillin, you suddenly, your skin can become blotchy suddenly, or your tongue can swell up, or you're having difficulties breathing, or something else happens so suddenly and so quickly. Those are kind of allergic reactions, and people, we tend to question people or the patients when they say allergy, what they mean, and we try to tease it out, you see. So if it's truly allergy, then they shouldn't have given it to you. Mm-hmm. They shouldn't have given the codeine. And the second aspect is if you're taking a medication for, if they did prescribe codeine cocodamol for you, and they tend to try to limit it for a short period of time, and it's to prevent those kind of addiction problems, as you mentioned. You see, yeah. So and the shorter the length, of course, the better, because they're powerful drugs, and they can cause problems on a long-term basis. Addiction is a big problem, very
Yeah.
big problem, you see. So
Yeah.
we have to be careful.
Well, yes. I mean, I thought they should have explained to me properly, because I don't know whether this is an allergy, but when I used to take cocodamol, I would be all nauseous, bad feelings, and I just had to stop. And every time I stopped, it would go away. So they know
So
about.
you're having side effects, you see, too, and you're not.
Oh,
Yeah,
that's side effects.
yeah.
But
Okay.
when they look
But
into
those are
my,
quite, if those side effects are quite severe, then yes, they should not have given it to you back again. Yeah.
yeah, that's the first thing.
Yeah.
And then giving me something that I could become addicted to. I mean,
Well,
if I didn't ask
it's
questions,
yeah. Well,
I might have gone back. I might have gone to my doctor and said, "Can I have another prescription?" And they would just give it to me. And next
yeah.
thing you know, I'm a druggie.
Yes. Let's not
But-
stretch it too far. But I take your point. That's why she mentioned it. Just take it for 2 weeks.
1 minute, I have to
Yeah.
turn the oven
Yeah.
off.
If it's just to take it for 2 weeks, then that's what they mean. You see, to take it for 2 weeks.
Okay, while Doris is away, there's a question.
I'm back. I'm back.
So,
I could smell the food burning.
okay. So, Doris, did you not go back to your GP or go back to the clinic who prescribed this?
I have no faith. I have no faith in them, but they should give me that in the first place, having looked at my records and not explaining to me exactly what they were giving me. If I hadn't read the instructions that came with those tablets and had just started taking them, goodness knows what reactions I would have had. So
Well,
now
good
I'm
on you.
Yeah.
Good
Good
on
on
you.
you. Yeah.
You read the notes, and that's very good of you to
Yeah.
be alert. Thank you, Doris. And before we go on to Mayuri, there's a question on the chat. Diabetic patients take 4 types of medications not controlling sugar levels. However, having gone for Manjaro injection once a week, diabetic sugar is under control. Should GP reduce other diabetes medications? Yes.
Well, so who started the Manjaro? So that's the question. If the GP started it, then it is up to him to make sure it is monitored correctly. You see, so
Exactly.
if the person who bought this, if I don't know what the question is, but anyway, so if it depends how they got the Manjaro. You see, so if they are buying it, I don't know. We don't know if they are buying it.
It's the GP, according to this message, it's the GP who prescribed Manjaro.
Okay. If the GP has prescribed it, then the other drugs should be looked into as well, to see that the HbA1c is well controlled,
Yeah.
and the blood glucose is not dropping too low actually. Yeah. So that's the important bit, and the benefit of Manjaro in type 2 diabetic patients are many actually, and the reason why they give it to you, it reduces weight. They lose quite a lot of, as long as they keep taking it, and they lose a few kilograms. That's important, as long as they're exercising as well, and as long as they are reducing their carbohydrate intake as well, all the carbs, you see, and they are exercising as well. And the other drugs, the need for other drugs, metformin probably will continue, but depends what other drug it is, what other two other drugs are, you see, and they need to be looked at, you see. But if one of the other drugs is like dapagliflozin or empagliflozin, that needs to continue. So depends what the combination is, you see. And the most important thing with diabetic patients and this group of drugs is not only controlling the blood glucose, but the most important thing in type 2 diabetic patients is that what kills them in the end. All the evidence suggests that it is the cardiovascular problems that causes more problems, you see. And this group of drugs, the newer group of drugs, reduces the cardiovascular deaths, you see. So that's the reason why they're giving it.
Okay.
As long
Thank
as she can tolerate it as well.
Mayuri, you have a question? Oh, sorry.
Sorry, Panaman. Can I add to that? So other medicine is Negaplazine and what was the other one? Metformin. And there's a third one,
Pioglitazone.
Pioglitazone. So should any one of those be stopped? Monjaro?
Monjaro, the GP started Monjaro, yes?
GP, it was a diabetic nurse who started Monjaro.
Okay, fine. Okay.
Because of arthritis and wanted to go for knee replacement. And my sugar level was not coming down. So after starting Monjaro, sugar level went under the control for them to do the
Operation.
so I've done the operation 2.5 months ago.
Good.
Not lost any weight or cutting down a lot on carbs, but the weight loss is not happening as yet.
Have you, are your legs swelling at all, anything like that?
Not really, because after having this knee replacement, I've had an infection.
Okay.
So that had to be controlled over about 4-5 weeks.
Yes.
Now the infection, it's all cleared. All that area is healing slowly, but the pain is still not going. I'm still seeing physiotherapist.
Okay.
While it was healing, while there was a tear in the skin, I couldn't do any physio.
Okay.
It was painful.
So yes, the Monjaro, the metformin, and the other drug that you mentioned, those are important medication for diabetes and are continue. And your blood glucose has come down, is it?
Yeah. As soon as I started taking Monjaro injection, it helped a lot.
Although they talk about blood glucose, the most important thing is the HbA1c. That is the blood glucose over 3-month period. That's the important bit, and that is to have come down quite a lot, you see. Yeah.
I don't know what it is at the moment because I haven't been to the GP for that, but which I'll get it checked. But when I do the weekly check, it's between 4 and 5.5.
Okay, so I think if your blood glucose is that low, then I think you need to ask your diabetic nurse whether you need pioglitazone, you see. Okay, because are you taking any other medication at all?
I'm on lots of medicine.
For your blood pressure?
Blood pressure, thyroid, all the other one as well.
Heart failure? You haven't got heart failure? No.
No.
Okay.
But I've had high level of potassium at some point, so which I'm monitoring now at the moment, not eating bananas and things like that. Potatoes cut up a lot on that.
Yeah.
So that's one thing they were monitoring, but I believe it is under control at the moment because every time I've done tests with GP, it came high. As soon as I went to the hospital in emergency, it came back to normal.
Okay.
So they're a bit concerned about that.
So there if your potassium is running, that you must have some kind of small kidney issues as well.
That's again, they're looking into it, but
okay.
There is anything on that side. I believe it's the food I was eating, bananas and potatoes.
Too many bananas.
No. I've done potassium-free diet for my husband because he's a kidney patient.
Okay.
So I've stopped bananas altogether, and other things I like soak before I cook or semi-boil, take the water out, and then I cook.
Okay.
I know how to control the potassium.
Fine, good for you. But I think if your HbA1c is well controlled, then you can get away with not taking the pioglitazone. But I think you need to discuss it with your diabetic nurse. If your blood glucose is running between 4 and 5, that is too good. Yeah.
I saw GP at one stage after my knee operation. She said it's better I wait about 3 to 6 months.
6 months, yes.
Full operation, they can't take medication.
Yeah. I think you have raised another important point with type 2 diabetic patients, and just looking at you, if you don't, not being disrespectful.
No.
We are big boys and girls in type 2 diabetic patients. Yeah. And the Manjaro, what Manjaro does is that it, as I mentioned, you reduce weight quite a lot, and that takes the pressure off the knees quite a lot, you say. And once you take the pressure off the knees, the likelihood of knee operation gets successful is much better, you say, and it stays better that way, you say. And there is quite a lot of evidence showing that as well, you see.
Yeah, so that's something I'm concentrating on, cutting down on meals and
Yeah.
chapatis, like having
Yeah.
just 1.5 chapatis and
Yeah.
not having solid
Yeah.
food like that.
Yeah. And exercises as well as much as you can.
Yeah.
Okay.
That's
Thank you very much. Nice
Thank
talking
you.
to you.
Thank
Thank
you.
you.
I think Ilaben has been on a very low dosage of Manjaro
Yeah.
because I've known her for a very long time, and
Right.
she has. I can't see her losing weight physically. Yeah,
until she has got on a proper dose, you see.
yeah,
Yeah.
that's right.
Yeah.
I think she's on a very low dosage.
You're right, Panapi. Yes, I am. Thank you so much.
Yeah. Okay, Mayuri, you got a question?
Yes. Do you know which medicines or group of medicines can have the side effect of nerve pain?
Sorry.
Sorry, Mayuri, you. Thank you.
Yeah. Do you know which medicines or group of medicines can have the side effect of nerve pain or muscle pain in the long run?
Muscle pain.
Yes, and no pain.
No pain.
No, N-E-R.
Oh, nerve pain. Nerve pain. So are you asking whether what medicine can be used for nerve pain, or are you asking whether what medicine causes nerve pain?
Yeah, what medicines can have the side effect in the long run of nerve pain and muscle pain side effects?
The muscle pain, the one group of drugs that are very commonly reported that causes muscle pain is the statins. So if you are on something called simvastatin or atorvastatin, and it is caused. So those are the group of drugs which are well known to cause muscle pain quite a lot, you see. With respect to nerve pain, I'm scratching my head as to what drugs can cause nerve pain. Those must be very rare, and I can't think immediately as to what drugs can cause nerve pain, but I'll have to search for that.
Okay, fine. So you said atorvastatin can cause muscle pain.
Yes, yeah.
Oh, okay. Yeah, so is there an alternative medicine to control the cholesterol?
Well, it depends. The statins are very good, extremely good group of drugs, and they control cholesterol very, very well. And when you've got muscle pain, is the muscle pain that bad that is causing you quite severe distress that you can't lift your arm or can't do anything like that? Or is it just annoying?
It's also muscle pain as well as nerve pain combination.
Okay.
So
what are the medicines you're taking, if I may ask?
Blood pressure, losartan, amlodipine. Not amlodipine, sorry, Delafine XL.
Okay.
I was on amlodipine for a long time. It was causing long-term dry cough, so discontinue.
Yeah.
The one is inhalers and montelukast and atorvastatin and pantoprazole.
Okay. And so are you still taking atorvastatin, or have you hold it?
No, I'm still taking
it.
Yes.
So you're able to manage with still taking it, and you're still getting the muscle pain.
Yes.
And have you discussed that with your GP?
I have not discussed it with my GP. I'm going to, but I thought since I'm on this program, I thought I would just.
Yeah. If the nerve pain, if the muscle pain is quite severe and it is causing quite a lot of distress to you, then of course you need to discuss that with your GP. Depending on your dose, they might give you a small dose to begin with, and then see how it goes. You see, but it's important to be on a medication to make sure cholesterol tablets are on the low, or the cholesterol is on the low side. You see, so that's because that is life saving. And if you can continue with that, but there are alternatives to atorvastatin or statin tablets. There are alternatives available, and the GP may be able to help you with that.
The atorvastatin is 20 milligram.
Okay, so that is you may want to try taking one tablet every other day and see how you go with that, rather than on a daily basis. And then once you tolerate that, then go back on one every day, you see.
Mm-hmm.
Yeah, see how you go with that.
Take a medication for cholesterol, you said.
Yes, yeah. You also mentioned inhalers. If I may change the topic, what inhalers are you taking?
The furosemide.
Furosemide is not an inhaler.
1 minute. I've got it. It starts with F. Flutiform, sorry, flutiform.
Okay. So
flutiform and the blue one is when required.
Okay. So can I see the fluticon, as you say?
It's the white body.
Okay, round one or
yes, the round one.
Okay.
Yeah.
So if you're using that on a regular basis, the need for the blue one should be less and less.
Yes. So, yeah. I don't use the blue one.
Very good. Yeah. So the blue one, the use of the blue one should be less and less. You see, as long as you're using the fluticasone, the round one, on a regular basis, morning and evening regularly. So the need for the other one should be less or non-existent at all. And once you use the inhaler, you rinse your mouth, making sure you don't get any thrush in your mouth.
Yes.
Yeah, very good.
That's good.
And okay, thank you very much for that.
All right, thank you.
If there are any other people using inhalers, it'll be good to know. Anybody else using inhalers? Nobody.
Seem to be.
No.
So,
that's good.
can I ask now again, what is the best way to take medication safely, especially when someone is taking several tablets every day?
Yeah, that's a good one, because many of the patients will be taking 5, 6, 7, 8 tablets of them. You see.
Yeah.
Now, there are certain tablets you have to take it on an empty stomach, and the ones that comes to my mind is the thyroxine tablets. The other one is some specific type of antibiotics that you have to take it on an empty stomach, and then you can take your food or your meal an hour afterwards, or an hour afterwards, something like that, you see. Because if you do take it with your food, the amount of the drug that is going to get in your body is going to be less, you see. So it's important, if the instruction says that you have to take it before food, then you do take it before food. The others, then it won't work very well, you see. And so that's very important. Now, most of the other tablets, it generally doesn't matter. And as long as you take it around the same time of the day, every day, that'd be fine, rather than keeping very big gaps in between, you see. So if you can take it at the same time, if it suits you to take it at night before you go to bed and go to sleep, that's fine. Or if it suits you to take it first thing in the morning, if it's once a day, then you have to take it that the time that suits you well, and I would stick to that. And but then the problem comes with tablets, like if you have to take it twice a day, or then you have to take it with your around breakfast time in your evening meal. You see, as long it doesn't, as long as it says that you there's no need to take it on an empty stomach. As long as it says there's no need to take it on an empty stomach, then that's fine.
So
Because
some
the
of
food can interfere with medication.
Okay.
And some drinks as well.
Yes. You mentioned thyroxine. Why on an empty stomach?
Well, the evidence suggests that the absorption gets better, you see. So more, and with thyroxine, the advantages of thyroxine, if you take it any other way, they can monitor it, you see. That they can monitor the thyroid function test, and they can adjust it. And that's how we have realized it, that if you take it on an empty stomach, the absorption of thyroxine is better.
Okay. So what should a person, well, often, I mean, if people are taking about 15 tablets a day, they are lucky to have a dosage box, so it's spread out for you. Take these in the morning, take these in the afternoon, take these in mid-afternoon. It works easier with the dosage boxes. But what should a person do if they accidentally miss a dose of their medication?
Yeah, so if they do miss it, it's not going to harm them immediately. But if they do, and if the next dose is due imminently, then they can take the next dose. But don't try to double up.
Yeah.
Do not try to double up, because it will cause more problems for you. So if you did double up on your blood pressure tablets or your diabetic drugs, you will be in problems. Yeah. So try not, it's best not to double up, you see. Yeah. Okay.
Yeah.
So if the next dose is due imminently, then just wait for that.
True, very true.
Okay.
So, how can we know whether a symptom is a side effect of medication or part of an illness itself?
Very difficult. I think you know your body very well, and if you have started a new medication and that symptom wasn't there before, then it's more likely that it is due to the tablets or the new medication. So it depends on the relationship between when you started the medication and the symptoms, you see, the symptoms that is different to what you haven't noticed it before, you see. So if it's that relationship between starting the medication and getting the symptoms, that's the important bit, and you realizing it, that this is you've started this medication and this is causing the problems, then you know your body, and then you have to tackle that with the people who prescribed that medication.
I'm so glad I'm not going through all this. I'm just asking questions and benefit for the
yeah, that's fine.
Participants.
Yeah.
But on side effects, again, what are the common side effects people should watch out when starting a new medication?
The main thing, if they start a new medication, as I said before at the beginning, they need to know what they're taking it for.
Yeah.
And the doctor or the person who started that medication should have informed you what the most common side effects are, you see. The most common likely side effects are going to be, you see.
Yeah.
And that's what you should be looking out for, you see. Because if you do when you get your medication, and there is a patient information leaflet inside the box that you get, you see, if you do read all the side effects there, then people will start imagining all sorts of things, you see. And so, okay, it is important to read, but more generally, if they're going to get the side effects, the more common ones are more likely to happen, you see. And if something that is different to you when you started that medication, that you didn't have that before, then again, it is different, and it's not, then you need to go back to your GP or your person who started that medication to discuss it with them. And if it is serious, then they will probably stop the medication. And if by stopping that medication and things get better, that does imply that the side effect was due to that medication.
So some of the side effects, are they, how can I say, should it be affected like as urgent or very serious?
Well, it depends. Some depending on the drug and the duration of treatment, the side effects doesn't happen all the time. Say, for example, if you're taking antibiotics, for example, just for 5 days, and say for chest infection, and some people will probably start getting some kind of diarrhea or stomach upset a few days into it, you see. But if that diarrhea is quite profound, that you're going to the loo 7-8 times a day, then that is not right, and that has to be reported to the GP, because that is not right. Yeah. So some side effects, you will know that is not this. Your body will notice it. That is not right, and you will notice it, and you should report it. But some side effects, people can cope with it, and so some people may have may have constipation, for example, when they're starting some painkillers, and they can manage it by changing the diet, making sure they're eating plenty of fruit or drinking plenty of water. You see, they can. So anybody who is starting a new medication, they should be informed what the common side effects are and how they can manage it. You see.
Yeah. I know we talked quite a lot about diabetes, but under iron deficiency, how many people, no, many people take iron tablets, and what is the best way to take them so they work properly?
As I mentioned in my talk, iron deficiency, probably half the world may be iron deficient, and women, because they are menstruating, they will be more iron deficient as well, and young females will be even more iron deficient as well. You see, and if they are being given iron tablets to take, the best advice currently is to take it on an empty stomach, nothing else, with a glass of water, or if you want to take it with a glass of fresh orange juice, and that's it. Just once a day, no medication, nothing else. You can take all your medication an hour afterwards, but not at the same time, and that's it. That's the best. And iron does take a long time to work. You see, it takes about three months before you notice any noticeable difference in your well-being. You see.
Yeah, I remember when I was on dialysis, I was given iron infusion. Every
yes.
3 months I was given the infusion.
Yeah.
That made me feel better, in fact.
Well, it does make feel patients better with iron infusions, because they work very quickly. They replace iron stores very, very quickly. And people, and there is quite a lot of evidence that people do feel much better with the iron infusion. And if people can't tolerate iron tablets, or if they've been taking iron tablets and they're not feeling any better, and then the GP needs to refer them to the hospital for iron injections. And sometimes people can get it privately as well. It's very expensive.
Okay. So if people are taking the tablets before someone feels better, how long does it take, or how long does it take for one to feel better after taking these tablets?
With iron, you need to be taking for at least 3 months.
3 months.
Minimum 3 months.
Yeah.
If you're taking correctly, to see whether you're start feeling any better. If you're tired constantly, tiredness is not improving, then it needs to be checked out.
Yeah. Yeah, I know you've also spoken about statins regarding cardiovascular and heart health. Many people are prescribed statins or blood thinning medications. What should they understand about these medicines?
Well, statins are used primarily after if people have had a stroke or have had a heart attack, or if they're diabetic, or they've had problems with their feet, cold feet, and have had problems with peripheral vascular disease. So that's when the statins are used. And in that particular case, it is used as a secondary prevention to prevent people getting further problems of getting further strokes, or to prevent people getting another heart attack, or prevent people getting other problems with the foot, you see. So it's to prevent further problems, you see. So that's one group of patients. Now, the other group of patients that people are given statins are people who haven't had any problems, but they have got high blood pressure, but they haven't had any strokes, or they haven't had any heart attacks, or they are obese, or they're big, and their cholesterol level is on the high side, and there's a family history as well of heart disease. So, and then they look at the risk. What is the likelihood of them getting a stroke or a heart attack in the next 10 years? And if the risk is on the high side, greater than 10%, they tend to give a statin to reduce that risk, you see. So that's the reason why they give a statin in that particular risk, and that is called preventative medicine, is to prevent people getting the heart attack or a stroke in the first place, you see. Yeah, so that's why the use of preventative medicine should be encouraged quite a lot, is to prevent getting a heart attack or a stroke. Stroke or a heart attack are quite consequential for the family, for the person and the family, you see. So it's to prevent that happening.
It's
So
also
that's
hereditary, isn't it?
sorry.
It's
No,
also hereditary.
no,
Okay.
it is not. It is not. Okay, majority of the time it is not. Majority of the time, stroke is related to high blood pressure. Majority of the time is due to high blood pressure.
Okay. So, what can families do to help older relatives to manage these medications safely?
Okay, if they are elderly relatives and they're taking a pile of medication, they need to ask the question, what are these medicines for? They really need to ask, is this medicine doing any good, or is it doing more harm? So they need to have an honest discussion with the doctor, and saying, I'm taking 15 medication. I'm now 80. Is there a real need for me to take all this medication? Because it is very easy to add medication on top of medication to medication, but it's very difficult to take medication off, you see. It's very, very difficult. And in the in the hospital sector, if their patients are in their 80s, 90s, sometimes we do have to ask the question, is it really worthwhile? But you need to have that discussion with the person and with the family, and what are the benefits of it, you see. Some medication will be needed, and you need to continue with that. But as long as you have asked that question and you are given the reassurance that there is a need for it, then you have to continue with it.
In your pharmacist role, when should someone go to a pharmacist instead of waiting for a GP's appointment?
Well, the pharmacy access is available when the pharmacy is open. They are available there. There you can ask them any questions, any kind of information. They are there if they are free, and they will speak to you. So there's no appointment needed. There's nothing. As long as they are able to answer your question effectively, that's one of the benefits of the pharmacy service.
Yeah. I know we've taken up a lot of your precious time.
No, it's no problem.
But what are your top 3 medication safety tips that everyone should remember from tonight's session?
The main thing is you need to know why you're taking it. So important, and to know how to take it correctly as well, and to know how long to take it for. And if you need to know those 3 things, so important. And if you don't get those 3 things right, then you are running into problems. And if you have got elderly parents, if they're going to the GP, then there should be somebody accompanying them to make sure they understand and to clarify things as to why they're taking the medication and the need for the medication and for how long and what are the common side effects. You need to ask those questions all the time. And also the other important thing is that if they are on a long-term medication, making sure that you're getting the same drug. It may not be the same company you're getting it, but it is the same drug that you're getting all the time.
Are they same effects if the companies are changed?
Yeah,
the tablets.
As long as it is from a UK pharmacy, then the guarantee is there that the drug will be of the same quality. We can't guarantee you if you're buying it from elsewhere or if you're getting it from elsewhere. But as long as it is from a UK pharmacy, UK registered pharmacy, then there is complete assurance that the quality of the drug will be there. But the same cannot be said for if you're buying drugs like Manjaro from the internet.
Yeah. Thank you very much, Uttamji, for such an informative and practical session this evening.
Thank you
we
very
are
much.
very grateful.
You know, the tablets that you take on an empty stomach, when you get up in the morning, you take those tablets. Then after taking the tablets, after 15 minutes, can you have breakfast?
No, I would wait for at least half an hour, 45 minutes minimum.
Before having the breakfast?
Yeah.
Oh, I see. Okay, fine. Thank you very much. Thank you for the lovely session.
Thank you, Mayuri.
Thank you.
Thank you again, Uttamji, and we are very grateful for you for giving your precious time at short notice, very short notice, and for answering everyone's questions so clearly.
Thank you very much.
Medication is something that affects many of us, either personally or through caring for family members. So your guidance on safe use of medicines, side effects, blood pressure, diabetes, iron deficiency, and general health concerns, that has been extremely valuable. Thank you also to everyone who joined tonight's webinar and participated with your questions. We hope you found the session useful.
Yes.
Thank you very much.
Thank you very much. On behalf of everyone, good night. Shubharatri to everybody. Thank you all.
Thank you. Bye-bye.
Thank you. Good night, everyone.